Hello everyone, welcome to another episode of Before and Beyond. Today I want to talk about lip ties or frenums as they are called as well. Lip ties can occur on the upper lip or the lower lip, and what they are is a piece of sort of extra tissue that connects usually from your lip to the bottom part of your gums, which is not near to your teeth. But in some cases, they connect too close to the teeth and can cause issues. They can also connect in between the teeth and cause there to be a space between the teeth. So I'll go through some sort of examples of frenums and what they can cause, what problems they can cause. So over here we have one that is, we call this a lower lip frenum. And the frenum is actually this part here, this extra tissue here that you can see. And the frenum, in this case, is attaching quite close to the gums around the teeth here. And when we pull the lip away from the mouth to visualize it, you can see that this part of the gum here turns white, and this is called blanching. So what is happening is that pulling motion is transferred through this frenum, this string here, and it's pulling on the gum close to the tooth. And we can see that this has caused the gum to recede down on this particular tooth. If we compare to other teeth, the gum line should be closer to here, around here. So we have lost, as it's being put down over the years, we have gotten a receding gums. And this yellow part that you see is actually the roots of the teeth. And this is the part that looks yellow because the roots of the teeth, they are not covered by the enamel, which is the outer layer of our teeth that looks white, like the ones on the top of the teeth here. This is the enamel. So as the receding gums occurs, due to this frenum pulling it, you can see that there is a lot of gum loss, there's a lot of receding gum exposing the root of the tooth, and this exposed part tends to become sensitive. It is also softer because it's not protected by the enamel, so it will also erode more quickly and cause you to lose part of the surface of that tooth. So this patient is quite a young patient, I would say. She's around 30 years old. And to experience this sort of recession at 30 years old is not very usual. And if we think about long term, if the frenum continues pulling on that part of the gum, we will see this to progress further down. And the roots of each tooth in the front teeth, I would say, it's it tends to be, I'll draw an outline of where it roughly should be. So usually it goes around like this, the outline here. So you can see that we've lost maybe half of the attachment. And if it goes down further and exposes further, the tooth is also at risk of becoming loose because it loses the support from the gums that's holding it in place. It's also going to lose the bone around it that's holding the tooth in place. And these supporting structures and gums and bones are what is also keeping the tooth healthy. It's a blood supply to the tooth. And as the gum recession continues and the tooth surface is exposed, it's also at higher risk of bacteria going into the tooth to infect it. So leaving it, this is a very gradual process. The gum recession, it doesn't cause any pain as it's occurring, other than maybe the tooth feeling more sensitive over time. And it's usually not really picked up unless we are looking at it and stretching out the lip to have a look at how it is affecting. So this is the buccal frenum of the lower lip, which is causing this. And the treatment is very simple. We need to relieve the tension of this pull by doing a frenectomy, or we also call that a lip tie release. It has been done in the past via surgery with a scalpel and stitches. Nowadays, we tend to use lasers, which are less invasive and usually do not need stitches. So the healing is usually much better, and the surgical process is also much easier for the patient. We have a water lace in the clinic, which is a laser that is especially suited for these sort of soft tissue surgeries, as it has very minimal or not almost none charring, which is like a damage to the tissues as it cuts. So with the water lace in the clinic, I tend to relieve the tension under local anesthetic. Patient usually doesn't feel much pain because it's all numb. And this part of the frenum here, we relieve the pressure. And so when we are doing the procedure, we also check periodically to see whether it's been released enough, whether the tension is still there when we pull the lip. And so by the time it's released, we should not see this part of the gum. It should not be red any further. It should not be white, sorry. It should not be white anymore after we have done this. I can't show you the after photo, unfortunately, because of certain guidelines we have in Singapore. But after the procedure, healing was very quick. We did a 1-week review and it was completely healed up. And we also saw some spontaneous recovery of the gum tissue. So the gum tissue actually crept up over the years as there wasn't this pulling force on it. And I recently saw the patient for 2 years post-op review. She's been coming to our clinic faithfully for cleaning, doing a great job at maintaining her teeth. And actually we saw that the gum has recovered so much that you could, it's covering a lot of the root back. So that's a very nice outcome, that we have stopped the progress of the gum recession due to the lip tie, and we have allowed there to have recovery of the gum tissue as well. And apart from the lower lip, this can also happen on the upper lip, and it can either happen on both upper and lower lips, or it can also happen on either of the lips. We also have, so this case you can see here is on the upper lip, and this is a very severe case of an upper lip frenulum or lip tie. As you can see here, it's a very broad band of tissue, and I'm just outlining it here. It's attaching to the lip, and it goes between the teeth. Sorry, just trying to outline it. Yep, it goes between the teeth, right between the teeth. And because it's so thick and it's going all the way to the back of the teeth, it is actually causing a space between the teeth. And this patient is fairly young. She's 16 years old. And these are all adult teeth. So with the presence of the frenum there, it's like a very thick band of tissue that prevents the teeth from growing on it. So the teeth grow on either side of it. So what this patient came in for was to close the gap, because she was very conscious about this space between her teeth. And to do that, we needed to do some orthodontic treatment to move the teeth together. So we did Invisalign actually for that. But because physically this lip tie, this frenum tissue, is blocking it, what we had to do as well during the Invisalign treatment is to also remove this, and also we use the water-lase laser to remove this entire tissue away, and then we could push the two teeth together. So these teeth to push that way, and this other tooth to move that way to close the space, and also to close out all the other spaces below as we did the Invisalign, all the other spaces around, straighten all the teeth. This is the same patient, just the smiling photo. So you can see the extent of the severity of the lip tie. You can see how it's pulling the inner part of her lips out as she's smiling. So and she's a very young girl, she's a very beautiful girl. She was very self-conscious because of this. Now I'm showing a slide of the same girl. She's 16 years old, a beautiful girl with a very nice smile, but she's very self-conscious because the lip tie, as you can see, is pulling the inner part of the lip. So this part here, this is the inner part of the lip, and as she smiles, this tissue in the middle is pulling it down. So this lip tissue is being exposed and when she smiles. So she's very, very self-conscious about this, and she tries not to smile because of that. So I wanted to show this because we managed to fix this by orthodontics, by moving the teeth together, and the lip tie was removed with the laser, with the water-lase laser. It was a very simple procedure, outpatient, under local anesthesia. She could go back to school. She did this on a Friday. She could go back to school on a Monday. So there was very little downtime for her. But these lip ties and tongue ties, it is very good to have it checked out early, because as they usually do not resolve by themselves, and as the teeth and bone grows, it grows around these lip ties, and as you can see, the teeth erupt next to the tie. They can't erupt through the tie, so there is a space that occurs even in a permanent teeth, which will require further treatment, in this case orthodontics, and also lasering of this amount over here, as well as some of the excess tissue. We also had to trim it away over here to expose the tooth to make it like a nice shape, all the excess tissue. So if this had been picked up early, then we could have potentially avoided all these complications. The teeth could have maybe grown out properly in the right position without having a gap there. And in terms of self-esteem, she's 16 years old, so that's many years that she might have felt very self-conscious about her smile and been affected by it. So I'm always an advocate of early intervention, early assessment, and if there's a lip tie, then for us to have a look at it and to see whether we should do something about it early, and save us a lot of sort of further complications down the road. And also many patients that if the earlier it's done, usually the less complicated the procedure, and the recovery is also very good, because we see patients as early as a month old. So even in a month old, usually these patients, the babies are picked up by the pediatricians to have a tongue tie because they have difficulty latching, difficulty breastfeeding. They're very fussy. They may have a lot of air or crying a lot, or what they call colic in babies. And usually these babies, there's a reason for it. When you have a lip tie and tongue tie, it's very hard for the babies to actually latch on or breastfeed, and they tend to have a very poor seal or suction to the breast, which causes them to suck in a lot of air while feeding. So as they suck in the air makes them very uncomfortable. They are bloated in their little bellies and they start to cry. You may see them also vomiting more, throwing up more, or spit up, reflux, that sort of thing more, because all that air has to come out. And in babies, it tends to come out through the mouth. And they might be labeled as very cranky. And there's also often a lot of pain with breastfeeding. So if these are identified early, it also helps the mom through the breastfeeding process. It helps the baby to be less prone to wean and to have less pain as they have the wean, and also less hunger, because as they are latching, they are sucking, but the milk is not being transferred out to them. So in the young babies, as we do this, there are certain advantages, which is we remove this tissue before the bone grows, because these lip ties, it can limit how the bone grows, and it can dictate how the teeth grows around it as well, like in this case. Also, sometimes it can cause speech problems. So when there's a gap between the teeth, some people may experience whistling sounds, or when pronouncing certain words, they feel like they have a air gap, or like the air is getting out, it's not being pronounced properly. Certain vowels like S sounds, T sounds, it requires a certain sort of flattening of the tongue against the palate to pronounce, and they may not be able to pronounce it properly because of the lip or tongue tie. And then if these things are addressed early, detected early and addressed early, then before the child starts speaking, in fact, it will not affect the speech. We see some children which are about 3 years old when they started speaking, and it's picked up because they can't pronounce certain words. And then by that time, because they've already started learning how to speak, they've sort of adapted to having that lip tie there, but they can't pronounce certain words. When we do the procedure, often they may need some kind of speech therapy to relearn how to pronounce words. Even in adult patients, we also see some patients, they come in because when they were younger, they had speech therapy and they learn to adapt. But maybe when learning a new languages, certain languages like French or Chinese, it requires a lot of inflection of the lips, movement of the lips and the tongue to pronounce certain words. And they might feel, oh, I can't actually do that because, of that physical restraint that the lip or tongue tie is causing. So it's good to detect this early and see if it's causing problems. Sometimes even if there's no speech problems, it could be also causing gum problems, teeth problems. Like we saw in the first case, it was causing gum recession. So it's always a good thing. And not all dentists will actually check for this during the routine dental checkup, because this is not something that's very sort of widely known or checked for. And also if it's not painful, a patient doesn't complain of any particular problem, then it may not be picked up. So you could do a self check at home as well. You can lift up your lip, just sort of lift up in front of the mirror and have a look at that line. Where does it attach? Does it attach to, for example, does it attach to in between the teeth? Oh, sorry. Just draw that again. Does it attach to in between the teeth? Then if it does, then you do have a lip tie. So if it attaches anywhere around here, you do have a lip tie. Does it attach to somewhere around here? So you can see the gum actually has two colors. There's like a darker color, so this is the free gingiva, or it's more sort of loose. And then we have the fixed gingiva, which is attached to the bone. So if it attaches somewhere in between this zone, then that's probably fine. But if it's anywhere around to the teeth, roots of the teeth, and especially if you see, for example, in the first case, I'll just clear all that off so we can see. Especially if you see this whiteness, as you pull your lip down, then you should come in for assessment and see if it's causing you any problems. Because you can see, like in this case, the frenum is attaching near to the teeth. But if we look at the other teeth, it's not that near, but it's also causing some blanching here. So over time, it may also cause that to recede down. And also, of course, around this part here, that's really a very obvious pull. So this sort of self-check you could do yourself and see if you want to come in to have a look at that. So with lip ties, these are some things that you can look out for. I hope that was helpful. And if you have any questions about lip ties, please leave us a comment. And I'm very happy to answer them. We could also do maybe a second video if you're interested to hear more. Thank you so much for your time.